Hello and welcome to this webinar on Health of Asia, Enhancing Health and Wellbeing in Asia. Brought to you by the British Chamber of Commerce Singapore and Prudential Singapore, this session is set to delve into the challenges people across Asia face in improving their health and their wellbeing, the opportunity offered by digital health technologies to improve wellbeing and access to healthcare, and what can be done to better enhance and wellbeing within Asian communities. Prudential are champion supporters of the Chamber, and I'm very excited to get this session started. We have a truly fantastic panel for you today. So without further ado, I'd like to welcome Ping Tan, Head of Corporate Affairs at Prudential, to set the scene and to kick us off properly. Ping, a really warm welcome to you. I can't wait for this session, and over to you.
Well, thank you very much, David, and thank you to the British Chamber of Commerce for organizing this webinar this morning. And good morning, everyone. I'm delighted to welcome you to the Health of Asia. So we are all here today to talk about the ever important topic of health and well-being, how people across Asia are looking after themselves and what the health outlook is like, especially given this COVID times that we're living in. So today's event is anchored in a piece of research that Prudential conducted across Asia in collaboration with the Economist Intelligence Unit. 5,000 people across the region were interviewed for this piece of research last year. And today we'll be discussing the findings later with our panel of experts. Please join me in welcoming first, Yoong Kang Z. Z is the CEO of the Singapore's Health Promotion Board, HPB. He champions the work of the board in helping Singaporeans increase the quality of years of their life. He has served in various capacities in the Singapore government as well as the private sector in his career. And next, Professor Paulin. Professor Paulin is a director at the Center for Research on Successful Aging, also known as ROSA, and that's at the Singapore Management University. So Professor Paulin's work at ROSA focuses on defining and measuring well-being holistically and identifying the factors that impact Singaporeans' well-being as they progress through life. And next from Prudential, we have Andrew Wong, who is our Chief Health Officer. So Andrew has over 30 years of international experience in management positions across Asia, Australia, Middle East, as well as Europe. Before joining Prudential, he was the Asia Pacific CEO of Munich Health. Andrew has also held a number of senior executive positions in Asia as well as the UK. And last but not least, we have Dennis Tan, CEO of Prudential Singapore. Dennis Tan has been a CEO of Prudential Singapore since March last year. He joined us just before, the start of the COVID period. He is also a council member at the Institute of Banking and Finance Singapore. Dennis is a veteran banker with 26 years of experience in consumer banking in OCBC as well as Citibank. Well, thank you so much to all our panelists for taking the time this morning to be here with us. Dennis, may I now invite you to kick off with some of your thoughts about the findings from the Prudential research?
Hi, good morning, everyone, and a real warm welcome to everybody. Thank you so much for spending the time, your morning, with all of us. And this morning, we are here to talk about a very important topic, right? The health of Asia. And together with our partner, the British Chamber of Commerce Singapore, I want to thank you for investing the time. I'm also delighted to welcome our esteemed guests. So Mr. Yoong Kang Z, CEO of the Health Promotion Board. Z, nice to see you again. Thank you for being with us. Professor Paulin Straughan, Director of the Center for Research of Successful Aging. Welcome. And we are also joined by Prudential's Chief Health Officer, Andrew Wong, my colleague from Hong Kong. So thanks everyone, and thank you to all the panelists for being here. Well, the topic for this morning is truly something that is, I believe, very important to all of us, right? It concerns our health as well as the health of our community. And today, Singaporeans actually have one of the highest life expectancies in the world. But we are not exactly living our longer years possibly in good health, right? Because about 2 in 5 Singaporeans aged 60 and above have actually 3 chronic diseases. And these growing disease rates are resulting in increased use of healthcare services and also growing claims, which translate and threatens the sustainability of our healthcare system. So the fact that most of these diseases are actually preventable, therefore it's important that we really make healthy lifestyle choices so that we can postpone or we can prevent and as a nation become healthier people here. But are people really making these healthy choices, right? Are they really taking matters into their own hands and improving it? And are they actually really doing it? I think these are the questions that we need to take a hard look at. And this is the subject of Prudential's latest research, the Health of Asia. And from our survey of 5,000 people across the region, we have learned a few things. And just briefly, allow me to share a couple of thoughts from there. One, I think people are definitely becoming more concerned about their well-being, and they are using technology to manage that a lot more. Specifically in Singapore, 61% of respondents use personal health technologies. And this shows the great appetite and the opportunity that exists with digital. And at Prudential, we have taken note of this. We have rolled out our own health and wellness app called Pulse by Prudential, which is on the mobile phone. And we launched it last year during the circuit breaker in Singapore. Basically, it's an app that helps encourage people to stay healthy and find out about disease risks. And if you're unwell, you can get telemedicine support as well. At the same time, we are also seeing that 39% of our respondents actually do not want to use health technology. I say again, 39% of respondents did tell us that they do not want to use health technology. And why is that so? Well, we understand from the respondents that mainly many of them find owning a smart technology expensive. Some have kind of commented that they prefer getting checkups in person, right? Face-to-face done in person. And while others may have a little bit of concern about data privacy. So again, these are all responses from our respondents, and we have taken note of that. Well, the second key thing in the finding in our survey is the importance of emotional well-being. And we know that most of the workforce have been spending their time working from home, right? Most of last year, and inclusive of even now for many people. So adapting to this new mode and this new environment of working from home, right? Together with the kind of overall uncertainty due to COVID, understandably, this will affect the well-being of the public at large. And 42% of our respondents in Singapore felt some form of stress, right? They're being anxious, they feel a bit depressed as a result of COVID-19. And as an employer for us, with 95% of our staff working from home, especially during the circuit breaker last year, we understand this in Prudential, right? And our heart really goes out to the employees. And we wanted to make well-being, not just physical, but mental as well, a priority, and to really help our employees feel better as they continue to work in this new normal. And the past year saw us moving literally our fitness classes that used to be in the office or in person. We kind of started moving a lot of these activities online as well as rolling out mental health initiatives to ease stress levels and to create moments whereby employees could kind of relax together and really unwind. So I believe many other employers, many other companies out there are also aware of these challenges and are also taking concrete steps towards employee wellness. And finally, if I can sum up the overall sentiment from the study, from the survey, about 1 in 3 Singaporeans believe that their health will be better this year. Well, this to me represents a challenge that needs to be overcome. How can we shift our attitudes to be more positive despite the circumstances around us? And how can we motivate people to take charge of available tools, such as digital tools or apps, to make tangible improvements onto our health as individuals? So, well, this morning our panel aims to dive into these very questions and unearth the insights and ideas that we can really try to pull together to enhance our well-being in the community. So I really look forward to an enthusiastic discussion this morning, and thank you, everyone. Back to you, Ping.
Well, thank you so much, Dennis. We will be taking a closer look at the three key findings that Dennis has just shared. So that's later at our panel discussion. But before that, let's kick off with a very quick poll. We want to hear your views on what do you think is the biggest barrier people face when it comes to staying healthy? Is it the lack of time, the lack of adequate finances, high cost of healthcare? Is it the lack of awareness or the lack of reliable and accessible health information? It'll be interesting to see, what the audience has to say. This was a question that, we also asked the 5,000 people across Asia when we conducted the survey last year with the Economist Intelligence Unit. Do we have the results, Helen?
Yeah, absolutely. So they're now shared on everybody's screen.
Lack of time, 61%. Lack of adequate finances, 10%. Lack of awareness, 24%. And lack of reliable and accessible health information, 4%. Lack of time, well, I'm not surprised here. I think Singaporeans are pretty, time-starved. I would pick the same thing as well, the lack of time to be healthy, lack of time to exercise, lack of time to go for health screening, lack of time to, eat right and eat healthy. And that's something that, I actually would pick as well, because, staying healthy sometimes is something that we know is important, but not urgent. So we tend to procrastinate and just push it aside. Very, very interesting finding here. And now I would like to invite Andrew Wong, our Chief Health Officer at Prudential Corporation Asia, to share with us what people across Asia answered to that question. Andrew, over to you.
Thanks very much, Peng. Thanks for your kind introduction, and thanks, Dennis, for inviting me to speak at this important webinar. What I'm going to do for the next 10 to 15 minutes is to share with you the background of this particular research study, the findings and also the recommendations, and how Prudential as an organization can contribute towards the healthcare of the residents in Asia. So next slide, please. So Prudential, as an organization, we are a life and health insurer. Our goal is to make healthcare more affordable and accessible to everyone in Asia. And this is in line with our We Do Health promise, and also our desire for people to live well for a longer period and also wealthier in the future as well. So over the last 2 years, we have evolved from a traditional insurer to a health manager by providing people access to digital services which can postpone and prevent the onset of diseases. We have partnered with the Economist Intelligence Unit in an important step of this journey in order to take the conversation on Asian healthcare forward. We also want to increase the understanding of how Asians think and feel about health and wellness. And we also want to understand the challenges people in Asia faced in terms of improving their health and well-being. And finally, we want to be better informed on how can we direct our efforts and resources to advance healthcare for all of us in Asia. The next slide, please. This particular report is groundbreaking, and for the first time ever, it helps us to understand how individuals across the region are using technology to manage their health and well-being. And it shines light on the challenges that societies in Asia faced and how all of us would be able to improve health and wellness in this part of the world. As Peng and Dennis mentioned before, this particular report surveyed 5,000 people from 13 markets in the Q3 or Q4 last year in Asia. That includes mainland China, Cambodia, Hong Kong, India, Indonesia, Laos, Malaysia, Myanmar, the Philippines, Singapore, Taiwan, Thailand, and Vietnam. So it's a very comprehensive study across the region. Next slide, please. So what I'm going to do is to share the findings with you over the next few slides. Next slide, please. So the results of this report shows people across the region, they don't really have shortage of personal health information, even though the quality of information do vary. And it's very obvious that social media is the most frequently used source of information for health and wellness, about 50% of them. And then the other result of the survey is that information from governments and public health authorities are the most trusted source of information. So about 70% of the respondents agree that one. So it should not be a surprise to a lot of us. However, overloading of information is a problem, especially during the outbreak of pandemic. About 53% of the respondents say that the volume of information available is so overwhelming that they don't know how to focus on in terms of the volume of information they receive from different sources. So I think individuals across Asia, they do sometimes struggle to understand which particular source of information are reliable, as well as how do they prioritize the information they receive. Next slide, please. So the report shows that communities in Asia, they have awareness of the connections between wellness and diseases, and that's been growing due to the outbreak of COVID-19. About 52% of the respondents have taken 2 or more measures in the past 3 months to improve their personal health, mainly by engaging more physical activities and also change their eating habits. About 24% of them, they have taken actions to improve their mental health at a time when more than 1 in 3, they are suffering from greater stress, anxiety, or depression due to the outbreak of pandemic, as Dennis mentioned earlier. Next slide, please. This particular report also shows that people in Asia are generally optimistic when it comes to health. However, the optimism about the future is negatively correlated with the average life expectancy. For example, Hong Kong and Singapore's life expectancy among the highest in the world, but residents are relatively downbeat about their personal health. So in less matured markets such as Indonesia and the Philippines, they are relatively positive about the state of their personal health in the near-term outlook. These markets, they are consistently more optimistic about their ability to manage their health and wellness. And the exceptions to that is evolving the financial constraints and access to medical facilities. Next slide, please. One of the biggest barrier people's ability to live healthier is that the healthcare in many places, they are not that affordable and not easily accessible as well. So our report uncovered a number of findings. Over half of the survey respondents, they're prevented from taking actions to improve their health due to financial constraints. The figures are higher in less mature markets such as Thailand and Vietnam. And even more concerningly, less than a quarter of the respondents, they can have access to exercise and fitness facilities that would help them to improve their personal health and wellness in the coming year, which is quite alarming. Next slide, please. So many of the survey respondents already use a wide variety of personal health tools. This include smart watches, thermometers, blood pressure monitors to help them to manage their health and wellness. Digital health, of course, consists of more than just gadgets. It's getting the population for people to use telemedicine consultation services and also online chronic disease management programs. The value of digital technologies would be enhanced if they were all connected to centralized database, such as the electronic patient's record. However, today is only a reality in some markets like mainland China, Singapore, South Korea, and Taiwan, and not for all the markets we have in the regions. There is clearly enormous potential to exploit technology so as to improve the access in terms of giving guidance, advice for healthcare, as well as to deliver healthcare solutions to millions of people in this part of the world. We are seeing the trend play out in a high uptake of pulse, which is the health ecosystem, as explained by Dennis earlier. At the moment, we have more than 20 million downloads in the region since its first launch in Malaysia in August 2019. So they demonstrate appetite, the use of digital health technology in Asia by the residents here. Next slide, please. So Asia is at the forefront of digital economy, and there's an opportunity for us to leverage technology and digital channels to provide affordable and accessible healthcare for all of us. Next slide, please. So the Pulse of Asia report highlights the growing demand from individuals for digital tools and services, which would improve access to healthcare. About 81% of the respondents said technology has already improved the access to health services. And about 2 out of 3, they do believe that it has improved the affordability. And what's more is that 3 years from now, more than 70% of the respondents said they would rely on technology even more heavily in order to improve their own personal health and well-being. So these results indicate that health tools and services can fill the gap for many of the Asian markets left by the understaffed health systems, and particularly where access to medical doctors and healthcare professionals can be challenging. So the uptake of digital health offers the opportunity to close the gap between developed and less developed markets by helping to combat the pressing challenges of unaffordable and inaccessible healthcare. This is a critical consideration for all of us as we continue to build out the services of Pulse to support people across the region. Next slide, please. So what are the implications for health policy makers and also for the relevant stakeholders in the regions? While it's positive to see that Asia has taken the step to embrace digital health technologies, I think the governments and the relevant stakeholders, they probably need to make a bold policy changes to unleash the full potential of technology to improve the health and wellness in the regions. So there are roughly 5 key recommendations in the report. The first one is that there's a pressing need to improve the public health information access through digital channels. The outbreak of pandemic, the COVID-19 serves as a daily reminder for all of us, not just because of the importance of healthy lifestyles, but also the importance of countering misinformation, where a particular problem on social media platforms. I think the government and industry experts can seize the opportunity by becoming the most reliable source of quality health care information for their own citizens. So the second recommendation is that the creation of a digital health ecosystem would benefit hugely both the individuals and health authorities. So there's a need to be underpinned, of course, by the strict data privacy regulations and also the data governance as well, so as to ensure that everybody is comfortable by having their own data or personal health records in a centralized database. And also that would empower the build-up of more targeted healthcare infrastructure. So the third recommendation coming from the report is that the journey to be undertaken involving both the public and also the private sectors. When we talk about employees of organizations, the well-being of these individuals, they're not only benefiting to themselves as employees, but their well-being and their wealth and their health, they also benefiting the business as a whole, the economy, and also the society. So I think companies should be encouraged to provide more training, more support to the employees in order to manage their own personal health. So the fourth recommendation coming from this report is how do we fulfill the potential of digital healthcare to a greater degree in terms of the public and private collaborations. So government can partner with private organizations to deliver the digital platform and solutions and initiatives so as to provide and promote and manage health among the citizens in their respective markets. So the final and the fifth recommendation coming to this report is that how to treat mental health on par with physical health. As Dennis mentioned earlier, that the toll of COVID-19 is taking on people's mental health and emotional well-being is well documented. And despite the increased optimism brought by the vaccines, all of us, we still face a lot of uncertainties. We still face a lot of unpredictable lockdowns and frequent isolations from friends, family, and co-workers. So it's very clear that the pandemic will continue and it will not just go away. And it's going to take a toll on all of us emotionally. So we have to pay extra attention to that. Next slide, please. So how Pulse, the ecosystem built by Prudential, can contribute and help? So Pulse is first of its kind in Asia. It's all-in-one AI-powered digital health application, catering to the health and well-being needs of Asian populations. So it was first launched in Malaysia in 2019. It's now available to 11 markets in Asia with more than 20 million downloads across the region. And most of the features, they are free of charge to not only the policyholders of Prudential, but as long as you have access to a mobile phone and Wi-Fi internet, you can download and enjoy all these features and services. So in terms of the proposition is that Pulse would empower consumers to take charge of their own health. They are provided with relevant healthcare information so that they can make their own informed decisions. Pulse provides 24/7 access to a lot of the relevant healthcare information. It can also improve the efficient use of healthcare resources and also, of course, improve the awareness of healthcare risk and promote preventive care as well. And we firmly believe that prevention is better than cure. So this philosophy and this proposition is very much aligned with the single government to push for more healthy living and make that easy, convenient, and also accessible. And I think the Healthy Singapore Task Force has been calling upon the so-called 3 E's, empowerment, engagement, and environment. I'm not going to elaborate in the details since C is on the call, so I'm sure that he's going to elaborate a lot later on as well. So next slide, please. So as I mentioned, this report was first of its kind in Asia, and we are fully committed to do that every 2 years in order to keep ourselves abreast of changing opportunities and challenges for the communities across the region. This research also shown digital has the potential to improve health and wellness across the region. And we're so proud to say that we're already taken a lot of steps, including Pulse, to deliver on this opportunity and meet our aim of making health more accessible and affordable for all of us. So if you'd like to see the full report full copy of this report, you can find that by scanning the QR code or just following the link on the screen. So thank you for listening to me. Back to you, Pink.
Well, thank you so much, and Andrew, for that very interesting Pan-Asia insight into how people are managing their health and well-being. Well, let's now bring this discussion closer to home and look at how the health and well-being in Singapore from the lens of the Health Promotion Board. As we all know, the Health Promotion Board has played an instrumental role in promoting healthier living among Singaporeans through its many initiatives over the years, and most notably the STEP challenge that we're also familiar with. I would now like to welcome our next presenter, Kang Yoong, the CEO of the Health Promotion Board. Over to you, Z.
Thank you, Ping Ping. I would like to begin this presentation just by stating my goals for this talk. The first is to do the easy thing, which is to state a truism. And the truism is that health is more important than healthcare. And I think no one will disagree with me. But that leads us really to my second goal, which is to remind everyone then that really, if you believe in that truism, then the way that the world has been looking at the issue of health has been wrong, right? I mean, we have been focused very much in building hospitals, investing in more advanced treatments, and so forth. And the majority of time, effort, and attention, and obviously Prudential's also claims are spent in really patching up things after they've gone wrong. When we all know that the right answer, and we've been talking so much about it, including what Andrew so eloquently stated earlier, really is to prevent people from falling sick in the first place. And we all know that falling sick is inevitable. But we all also know that the worst ravages of what we've been so concerned about, chronic diseases, the best way to ensure that we don't get into trouble on that front. And we know how enormously expensive chronic diseases are, not just financially to our countries, but in terms of the cost to our own lives and the quality of our lives is just immeasurable. So we all know why it is, because we are humans. We always defer the day when we have to think about when we get into trouble, or we only think about trouble only when we get into it. But then I would then want to then make that third point, which is the part really what this presentation is about, is that we should and we can do a lot to improve prevention. And maybe Helen, you can show the first slide. Yep. And historically, I want to start off then with an optimistic note. Why we should is that many societies, most societies in fact, have succeeded over time to improve the healthy lives of their citizens. In Singapore, you shows this example. And the bar is an interesting bar. We are talking about healthy life expectancy, not life expectancy per se, because life expectancy in every country is much longer than healthy life expectancy, which, to grossly simplify, is the number of years that you can expect an average person to spend without starting to get sucked into a chronic disease. And you can see from this bar that over time, because of improving lifestyles, and that runs counter to the narrative that maybe we've been saying, better sort of preventive measures, countries have been able to widen, lengthen the time frame we can expect people to live more healthily. And we all know what drives this number, healthy lives, which is really getting people to have better diets, getting people to exercise more, and getting people to smoke less. And like many countries in the world, and it's simple to track this, we have improved actually our diets. So we have, strangely enough, you may be surprised to hear that, we have been exercising more and have been smoking less. And I would argue that it should be the proper focus of healthcare systems to really help their citizens move along some of these basic dimensions. Despite the fact that most attention has been spent on healthcare, I think we can and we should make progress in helping our citizens to live more healthily, because the dividends that we pay in terms of then extending healthy lives are immeasurably greater than whatever investments we put into this. And that's the mission of Health Promotion Board. And it is much to my regret that most countries in the world are not fortunate to have a focused agency that looks into this. Health promotion globally has been really scattered amongst NGOs and hospitals, people doing things in the spare time. But to sound an optimistic note, and I also to follow up on what Andrew said, digital technologies offer us a way out to become much more effective in these interventions. The next slide, please, Helen. And I would sort of share three aspects why digital is so powerful. First, those of you involved in public health know how time-consuming it is to persuade each individual to change their lifestyles. But with the advent of especially cheap wearables and high-capacity data analytics, we are able to scale up public health interventions to a scale that's unprecedented in history. And because of the real-time nature of much of digital technology, we are now sort of moving away from the days when you take 5 years before a new health survey comes in, and an entire career to establish the time series and come up with some conclusions over the state of public health. We are now able to track many of these measures in real time. And the prospect also of big data, artificial intelligence, and very high fidelity tracking of especially digital signatures that are tied to lifestyle allows us to develop more and more personalized interventions in public health to assist our people to live more healthily in a way that is real for their own preferences and for their own circumstances. I'll give you a bit more detail in each of these cases. Next slide, please, Helen. As Ping Ping mentioned, those of you who live in Singapore will know about the National Steps Challenge. And essentially, those outside will just explain that over the last 5 to 6 years, the Singapore government has been issuing cheap trackers. They cost in the region of 10 to 20 US dollars each, and been giving incentives to Singaporeans. If you walk a certain number of steps, you win a very low price voucher. And this has been enormously successful, and you see that it's become a social movement that over the last several years, we've managed to enroll more than 1 million of our citizens collectively into the program. And that's one of the biggest, I would say, direct public health interventions that you can see anywhere in the world. And it has been enabled by the fact that now trackers cost only $10 to $20 each. It has been enabled by the real-time ability for us to sync the steps data and push micro incentives to individuals so that they get this little sort of buzz from getting a $5 voucher for walking enough steps. without the advent of such technologies, the massive scale by which we have been able to intervene in the population would have not been possible. And you see the impact. The bottom left-hand chart shows that over time, even in periods when people are not given incentive, the amount of steps that our participants have been taking have grown tremendously over the years. And it's a major experiment on how effective some of these technologies can be in just shifting behaviors on a massive scale. Next slide, please. Health promotion, but we've also been undertaking what we call the Health Insight Singapore study, where we have been trying to break the tyranny of our old traditional health studies, where when we enrolled people into some of these surveillance studies, it takes years before we get each new data point out. Typically, for example, the National Population Health Survey time frame used to be 5 years before each new study comes. Now we've enrolled our study participants into a surveillance study where they wear essentially a Fitbit, and we can track in real time their health behaviors over periods of interest across a wide range of dimensions, including diet, physical activity, and in this instance, sleep. And for example, in the last lockdown in Singapore, the question being asked was there a negative impact in terms of health behaviors, such as, for example, sleep? And real time, through our study participants, we were able to see a very interesting set of patterns during the lockdown period, which in Singapore we call circuit breaker, where people end up going to sleep on average half an hour later than normal, and they stay in bed close to an hour more, and they end up sleeping more. And it's like something that people can hypothesize all they want, or even conduct surveys, but we are able to track real time what happened during lockdown, and then also immediately after the lockdown can see how people respond in terms of their health behaviors, as you see in the gray side of this chart. And this, to me, as a public health official and to our researchers who are jointly working with us on this project, this is something pretty much unprecedented in their professional experience. Next slide. And the third dimension I alluded to was really the personalization of health interventions, how to make nudges, for example, real to an individual's habit, how I would respond to incentives or to messages and so forth are very different from anyone else in the room. And what within HPB we are doing is, through the data, for example, that we're gathering through the National Steps Challenge, after we have anonymized them and analyze them, we are able to cluster the users of our various programs into really many different tribes with different kinds of digital behavior typed by what we call digital phenotyping. And over time, we've been able to personalize the kind of messages that we send to individuals back to them on their devices, aligned to their specific digital phenotype. And Andrew talked about collaboration with the private sector. We've opened also up some of these programs to private sector players, and you can see some of the digital giants in this, especially Apple. They have been partnering with us to devote some of their best digital AI and behavioral theorists talents to see how we can better hone messages delivered through their devices, so that they can be more personalized to the needs and wants and the behaviors of individual users. And over time, you will find that with the appropriate privacy measures in place, there's a lot we can do so that we can hone some of these interventions to the needs of individuals. And it's an exciting new area that's making so much progress and making our program so much more compelling and effective. Next slide. And I want to end this by saying that despite the message generally of using technology, HPB continues also to be very focused in the traditional approaches. And we have programs that reach out to individuals still in their, where they spend most of the time, especially for this audience, which is very pertinent. We still have a very active program to reach out to individuals in workplace. And we fund partners to see how we can improve the health, for example, of workforces. And we'll be delighted to continue this effort to push. Andrew talked about the importance of wellness. And we know that as a corporate agenda, wellness also has emerged as a major priority. And I would like to just share that despite us investing so much time in digital technologies, we have still not moved away from traditional interventions. And we welcome interest from this audience to reach out to us to get on this journey together. Thank you very much.
Well, thank you very much, Zee, for that very interesting sharing. And that's indeed a great lead into the panel discussion segment, of today's event. May I ask all the panelists to switch on your cameras? So welcome back, Andrew, Dennis, and Professor Paulin. Well, let me begin by posing the first question to Andrew. Andrew, I'd like to focus on a key insight that emerged from the study, from the Prudential study, around the overall state and outlook of health. So the barometer constructed for the study actually shows that Singapore was in the bottom 2 of all the countries surveyed when it comes to health outlook. Why do you think this is the case? So this is the outlook of Singaporeans, right?
Yeah,
the
yeah,
health
absolutely.
outlook of Singaporeans, yeah.
Yeah, thanks very much, Ping Ping. So it's a very good observation and interesting question. So I have to emphasize that this is nothing to do with the clinical outcome or the effectiveness of the healthcare system in Singapore. Is mainly the perceptions from the residents in Singapore about the future outlook. And in fact, Singapore is not alone. Hong Kong is at the bottom of the survey, and I think both Hong Kong and Singapore they do have very effective public and private healthcare systems in terms of clinical outcome, and as a result, the life expectancy for these two markets, they are probably the highest in the world. And I think both female and male life expectancy range from anything 84 to 86 years old. That's probably the primary reasons why people, they are relatively downbeat about their future healthcare outlook, because of they are well informed through various sources that the longer you live, the higher the likelihood for you to have a chronic disease like high blood pressure, high cholesterol, and even you're more vulnerable to things like heart and stroke, and also cancers as well. And also given the high cost of living in these two markets, I think Singapore has been consistently ranked as the most expensive place to live in the world. So the cost of hospitalization and admissions, and also being treated at hospitals, the costs are very high. And then as a result, people, they do worry about how to finance all these treatments into the future. So I think the other ways you look at it is that are the other markets, or are the other less developed markets, they are too optimistic about the future outlook? Do they have access to the right information? Are they presenting the real picture So that's something that we need to think about. And I think maybe the government or the relevant stakeholders in other markets, they need to think about how to provide a more holistic picture to the residents so that they're aware of the future healthcare needs and how to prepare themselves and how do they have access to all these relevant healthcare information, and also take the necessary steps to prevent themselves from getting into all these troubles in the future. Thanks, Peng.
Well, thanks very much, Andrew. Again, just to emphasize that this, basically we're talking about Singaporeans' perception of their health and well-being, not the actual current state of health and well-being. Z, just going to you on this question. Any thoughts on what Andrew has just said about why Singaporeans are kind of kind of relatively, more pessimistic about their health?
Yeah, I think many of the points Andrew made are quite real. In our surveys, we do pick up that people are worried about, for example, healthcare affordability. Of course, as a government, we try to do our best to address some of these issues. But of course, I think there's also an element of just culture coming into play. If I look at your bar, if the top three most pessimistic societies tend to be, majority Chinese societies. And I think there's an element of that, speculatively, I don't know whether Paulin will have any comments on the role of culture. But sociologists often sort of, posit societies that are arrayed between cultures that are a bit more focused on, the downside of life versus the bright side of life. But it's just a speculation. But I think what I want to say is this is no argument against trying to make people more aware of the importance of health and the dangers posed by chronic diseases. I think that's very important. I think having less health education, less awareness of the impact that, for example, your lifestyle would have on the future state of health is not the answer. I think we can do more to reassure people of the control that they have in terms of modifying their behavior so that they can avert the worst ravages of long-term health issues. But I just wanted to sound a note of caution that the answer is not to keep people blissfully unaware of the risks that they face.
Yes, agree with you, Z, because I guess complacency can be a real threat, right? If people are complacent about their health and not take any actions to improve their health and well-being, that can be a real threat in the long run. So just, staying on you, Z, the Health Promotion Board, like I've said earlier, has done a lot over the years, as the focused agency, as you mentioned, to improve the health and well-being of Singaporeans. What else, can be done, you think, to achieve better health outcomes for Singaporeans so that as we live longer, we can also extend, our healthy years?
Yes, thanks for the question. And of course, the answer is we should do more on every front. And that's the intent. We just underwent a review of our strategy. And the quick conclusion is we will do more to see how we can intervene in the food market and work with food and beverage players to improve the quality of the food that they serve. We will do a lot more in terms of pushing out physical activity programs, a lot of them for free at a much wider scale. To reach out to pockets of residents that we haven't reached out yet, and especially to vulnerable groups of the society, low-income workers, for example. I think there's a lot more we can do to work with their employers, to address the fact that many of these low-income individuals have no time. We talked about that, to pursue health in their lives, and how do we then sort of inject more healthy habits within the workplace, for example, for security guards, for our cleaners, for people who work in small, medium enterprises. How do we get better at that? We also will be doubling down on technology. so that we will get to be more precise in our interventions and achieve a much wider scale and scope of our interventions. And one area that we haven't cracked yet is to improve early detection. I think we are somehow quite frustrated that the number of people who come for screening is stubbornly stuck at about 2/3 to 3/4 of the population, and large numbers of people don't go for screening and they don't see their doctors early for that intervention. I think there's a lot more we can do also then to integrate that preventive nature into our healthcare system. Get GPs more aware that their job is not just to patch people up after they fall sick, but to encourage their patients to come and for screening, and then after the screening, when the results come, don't adopt a fatalistic attitude that I can't change my lifestyle, but to actively coach them to make those adjustments. I think those of you who live in Singapore will know that actually we are still in a very episodic care and interventionist mindset rather than a prevention mindset.
Yep, thanks for that. Definitely, prevention better than cure, as we all know. And as Dennis mentioned earlier, also that a lot of, the chronic conditions that we see today can be preventable if they are detected, earlier, in the early part of the journey. Now over to you, Professor Paulin. In our earlier conversation, just last week, you shared with me a very interesting observation from your the research of your center. You mentioned to me that the incidence of chronic ailments last year seemed to have reduced. And that's despite the pandemic, right? So what is your sense of the current state of well-being in Singapore?
Thank you, Ping. Let me just caveat this for the audience that this is data that comes from the Singapore Life Panel, which sits in ROSA, right? The Research for Successful Aging. So what we do is we track 11,500 Singapore Life Panel members every month. They are from ages 55 to 75, right? So we were able to, on average, we have about 70% response per month. So about 7,000, or 7,500 responses. So we see that across the year last year, across the 12 months last year, when the circuit breaker stepped in April, then the number of self-reported incidence of chronic ailments dropped significantly, right? You can see the dip, and then it picked up again when the circuit breaker was eased and we went into phase 2 and then phase 3, and then things have picked up again. And this is not surprising because during the lockdown, we had deferred non-essential health services, right? So therefore, unfortunately, preventive care, health screening, all that was in the basket of non-essential. So the caution that we want to raise is, there is a backlog, right, in preventive health screening. Moving forward, and I'm glad that HPV is here, for HPV to pay attention to this and to try to recover, right, the loss in respondents who, and this we are talking about older respondents who step up for health screening. It's a pity that this has happened because it's taken Singapore and HPB a long time to normalize health screening. As Z had just pointed out a little while ago, the frustration of healthcare really is the inability to catch the ailments early. And even for chronic ailments, right, if we can just arrest them as they emerge, lifestyle changes, modifications, it's going to be a lot more effective. So the pandemic has really set us back in this aspect. And it will be very important that we address this when things start to normalize. If I could just ask Helen to go on to the next slide, just so that we can drive this across, right? In terms of well-being, so we tracked well-being across 12 months. And every month, but for last year, if Helen could find the slide for us, we also see that overall well-being, the data dipped, right? When circuit breaker stepped in, we saw well-being go down. You can see from April to June again, right? This dipped. We segregated it, right, from those who are living with co-residents and living alone. And you see those who are living alone, their overall well-being went down, more so than those who are living either with family or, with friends. So I just wanted to end, the sharing by a reference back to Z's point on what else can health promotion do. I think an important consideration for us is how to build up social capital in our community, right? Because government can't do everything. And then we see the importance of social integration, right? Just by this one simple chart, living arrangement. If you live alone, especially in your twilight years, it's going to be a lot harder, right? So how do we then ensure that regardless of our living arrangements, we will be embedded in a healthy environment, right? Where there is a there's a core group of volunteers, right, who would always be able to reach out, right, to our neighbors and to bring everybody, up on board. And of course, in terms of health screening, lots of literature, documented evidence to show that the strongest trigger, the nudge, right, the nudger would be the social support members, right, be it family members or very close friends. A nudge from them is sometimes a lot more effective than a poster from HPB. Thank you very much. Oh, this is not to say HPB is not important, mind you, right? This is simply to reinforce the fact that, we have to all work together, right, to promote well-being in the community.
Paulin, I agree with you 100%. Nudge from friends is way more important than any poster.
Well said, Professor Paulin. I think we all have a part to play, right? And what you mentioned about the community spirit, getting the community together to basically kind of get everyone to be healthy. I think that's really, really important, especially for people who stay alone, and don't have families near them. Then the neighbors become all the more important. And on that note, I think, I believe that insurance companies, like Prudential, also have a part to play. We talk about private public collaboration. So Dennis, just over to you for one question. What is Prudential doing to promote more preventative care and to help Singaporeans adopt healthier behavior?
Thanks very much, Ping, for that question. So talking about moving from protection to preventative care, I think firstly, I would like to share that I think that is quite a shift from an insurance industry perspective, right? Because I think from history and the many years that we are all familiar with the life insurance industry, life insurance is all about providing the protection solutions out there. And typically in the past, and we will continue to do so as well going to the future, the insurance company will be there in that sense during the rainy days, right? Rainy days defined as when the policyholder falls ill, or if unfortunately there's a disability or even a bereavement in the family, right? So that is a very protection-focused kind of approach. But I think as we pivot now, the whole industry and for Prudential very heavily, definitely is looking at us being there during the sunny days as well. So it's not just about being there in the rainy days. And what that means is therefore the importance of being there every step of the way with the customer, with the policyholders, in their whole lifelong pursuit of healthy living in that sense. So it's both sunny days, of course, as well as the rainy days. And therefore, in order to do that is the whole mindset shift of moving from just pure protection into now prevention as well. So to your point of prevention and how Prudential is actually doing, maybe just quickly two things that is at the top of my mind to kind of share with everyone. Number one is leveraging data, right, and leveraging technology, right? It's all about technology. So that's one. Second one I can briefly share also later on is a little bit about having creative, fun ways in keeping fit, right? So let's talk about the first one in terms of leveraging technology. And if you recall earlier what Andrew has shared about, and also in my opening remarks earlier, more than actually 1 in 2 Singaporeans, right? That means already more than half. In specific, it's actually 61% of Singaporeans in the survey have already showed us that they are actively using personal health technology. And in this fast digitizing and digitalizing world, a lot of Singaporeans are already using more and more of this technology to improve their health. And therefore, I think importantly, that's what Prudential is working hard on, is to leverage technology, leverage on these personal health technology solutions to partner strongly with the customers, partner strongly with our policyholders, and collaborating with a lot more of ecosystem players in order to provide digital wellness solutions to our customers. So this is the example of Pulse by Prudential, for example, right? Which is a health and wellness app that we have. And that app largely does, when we launched it last year, right, initially is 3 main functionalities. You can do an overall health assessment for yourself. And then you can do a symptom checker if you're feeling a little bit unwell, right? So there is an AI-powered algorithm and the technology behind that can aid you in better understanding your symptoms. That's the second thing. And finally, number 3, if you are really feeling unwell, then through this app, you can actually straight away click on it and you will get immediate availability of telemedicine, right? And then you can do that at the comfort of your home or in the offices or wherever you are without the need to necessarily travel to a location. And of course, subsequent to the consultation, you can have the delivery of the medicine to your intended address as well. So I think these are all providing a lot more convenience to help customers move into a preventative kind of approach. And of course, on the app, there'll be a lot more educational materials, things to really help people be a little bit more aware of healthcare and health prevention. Then very quickly, in the second point is, while we want to keep fit, I think it's important to not treat it as a chore, as a regime, but importantly, how do we nudge people to have fun as well, right? So while keeping fit. So there's one other simple way that Prudential is moving big into this area. And we recently launched, for example, our We Do Well Together campaign, right? So this collaboration is actually with a K-pop supergroup, right? It's called Super M. So it's not just here in Prudential Singapore, but around the world as well for Prudential in all the major Asian markets that we operate in. And what it does is really to help promote people to be healthy, to stay healthy, and at the same time having fun, right? So there's a whole lineup of interesting wellness-oriented activities. People can do dances, right? We release a music video by Super M as part of the campaign, and there are lots of different dance challenges on social media. So bottom line, one simple message, right? Staying healthy can be fun as well. Back to you, Ping.
Well, thanks so much, Dennis. Thank you for that. Indeed, staying healthy can be fun, and we should bring, our We Do Dance challenge into the community, as what Professor Paulin has just mentioned earlier on, that the importance of that community spirit in helping people stay healthy. If you have questions for the panelists, for Andrew, for Dennis, for Professor Paulin, or for Z, please type your question in the Q&A box. In fact, I've got one question that have just come in, is on the basically the rising healthcare cost in Singapore and actually across Asia and globally, right? So the question is, how can insurance companies and the government make health insurance more affordable and more inclusive? I think a lot has been done on this front, to really look at how do we address the rising healthcare cost, so that in the long term, actually more people, healthcare, will remain accessible and affordable to more people. Dennis, would you like to just kind of briefly talk about that?
Yeah, happy to. Thanks very much for the question. And I think this is something that is really important, right, in Singapore as well as in throughout the world. And this is also something that I think importantly requires many stakeholders to, in a concerted, unified manner, continue to work on this. I think we have seen a lot of progress and very, very good progress done, right? Be it in the medical fraternity, looking at government promotions, looking at what's happening in the private sector. And we are also increasingly seeing individuals also taking charge of that, right? Taking charge of their health. Because as individuals and families also focus on their well-being and to keep healthy, then definitely that is also part of the way to really kind of rein in the rising medical inflation and the cost increase as well. So I think the next step importantly is that as individual slivers work on this all this while, how can we build that ecosystem and have all parties coming together in a like-minded fashion way to really continue to promote that? And I think that is totally critical. And we are beginning to see a lot more of that. And as I explained and using the examples of what we talked about earlier, in just leveraging technology, for example, right? So in the past, like what I mentioned kind of earlier, in the past, you probably won't hear of insurance companies or really moving big in the health and wellness, not as big as what we are seeing now, right? And this can be had now in the recent period now because of technology, because of the rise of digital, and how can we leverage on that to really empower individuals, empower families out there to really, right, with information, with education, and at the same time with very simple tools that they can use. So these are all the different ways that, just for example, how an insurance company, which traditionally were just focusing more on the protection solutions, how that is actually pivoting in order to help rein in the rising healthcare cost. Back to you.
Yeah, indeed, Dennis. I guess, I think key to really addressing the rising healthcare costs is that, to stay healthy, if we stay healthy, that would, I guess, be, addressing the root of the problem. Hence, really the importance of preventative healthcare and also individual responsibility, right? I mean, healthcare is a very scarce resource. So, just kind of basically understanding that and using healthcare services in a very prudent manner, I think that would also, kind of address the rising healthcare cost. Okay, just talking about that, next question, I have for Z, employers, of course, have also a responsibility to play in making sure that their workforce is healthy. How can employers actually promote greater employee well-being, especially as employees adapt to new ways of working?
Okay, thank you. I think Singapore is quite an interesting market as far as employers are concerned. And I also observe, I used to work in an American firm, and then I worked for a Singapore employer. And I noticed quite a stark difference in the attitudes between these two sets of, I don't know what you call employer culture, and maybe Prudential, you can see it also among your clients. But there's a lot more focus, say in American companies, in trying to look at health, the health of their workers, right? And in Singapore, the attitude seems to be that, I've done my minimum in terms of just securing, ensuring everyone fills out the forms for the integrated shield plans, and, and then after you're really on your own. And my own theory is that to a great extent in the US, the employers through insurance picks up the tab. If the health of the workforce is deteriorating, it just expresses itself in a higher insurance cost. Whereas in Singapore, we tend to lay on the individual, or we socialize some of the cost of healthcare for the workforce. I think that has to change. Employers need to realize that quite apart from just insurance, the impact, especially of chronic disease especially also an aging workforce, is going to be, again, one of those things that you don't measure, but when you look closely at it, it's really something that you find that it really hurts your bottom line. right? We are not the kind of society where we were going to have too many young people who can join us. We have to take care of especially the older ones amongst us, and these are the people that are more prone to diabetes, high blood pressure, etc. And if you do not actively seek to improve the health behaviors, the reduction in productivity, don't even count the insurance costs. Just by people being more lethargic or calling more sick hours because of these chronic conditions is something that you really need to look into. And I think I would therefore encourage really employers to see how they can more proactively integrate workplace health programs as part of a good practice, right? In the field of, for example, workplace safety, there have been so much effort trying to get employers to own, whether the employees get into trouble falling from heights, etc. I think we need a similar movement to send the message to employers that this is something that you can control, that you should invest in, and government is delighted to work with you, and we can subsidize programs. But ultimately, I think HR departments, C-suite leaders need to put that on the agenda. And I don't think it's just physical health. We talked at large, Andrew mentioned about mental wellness, right? And I think there's a growing awareness of the huge impact that this would have also on productivity of the workforce.
Well, thanks, Zee. I think health, definitely a top priority for us at Prudential. Dennis, would you agree? Well, just kind of going, I see a lot of questions coming in. Just switching gear now to mental health, a topic that is of great interest, especially, during this COVID times, right? So this person is asking, for someone to comment on the support system for mental health issues, given that such issues can be chronic and can extend into actual physical diseases. And also many may feel that mental health problem carry stigma and hence not seek treatment. Well, Professor Paulin or Zee, would you like to kind of take this question?
Thank you, Ping. Perhaps if I could just start. I think that in Singapore, we have come a long way. Certainly in the past couple of years, there's a lot more attention focused on promoting mental health. And, we're very much aware that there is a social stigma attached to it. So much of the good work of MSF and MOH, I think, was, focused on easing that stigma and normalizing, the argument that mental health diseases are no different from other physical diseases, right? So mental health certainly is a chronic ailment, right? It's a long-term kind of a gestation, and essentially, I think here is where, again, community support and social support is extremely important, because if we rely solely on medication and hospitalization, that is not a good outcome, right, for those who are inflicted. And certainly it's very expensive, right, as well, just on the individual and the community as well. So if we could step up on social support care, right, and essentially, I think if I may be bold enough to say, and be bold enough as a nation to relook at how we organize everyday life. So let me give you a very simple example, right? So if we have loved ones or students who are diagnosed, right, with let's say depression, anxiety, and so forth, what we do is, in addition to asking them to seek help from psychiatrists, we also tell them, try to avoid stressor situations, right? Learn, where your sweet spots are, and learn where, the negative triggers are, and try to avoid the negative triggers. And much of that negative triggers is how we organize, our work life, and, that work-life balance, the competition at the workplace, and so forth. So I think it's important for us to acknowledge that, we may not we have a long way to go, right? To curate a more gracious society, and space for us to live in, where we can reduce as much as possible the stresses without losing our competitive edge, right? And again, that is a whole of society effort. I'm sure Prudential is in Prudential's interest too, to partner the various agencies in this, because when we can remove the triggers, then I think we are, I think half the journey, half the better is won, right? Thank you.
Well, thanks, Professor Paulin. That's very, very insightful indeed. So I've got a lot of interesting questions coming in. It's hard to kind of pick which one to ask. I'm going to basically talk about, pick a question on the use of digital devices and technology, since this is, a very much discussed topic today. So this person is saying that there's a delicate balance between promoting a greater use of digital devices for daily life and encouraging people to stay healthy, as well. Sorry, I'm just kind of reading this question again. Yeah, basically, while digital devices, can encourage people to stay healthy, make it convenient for people to stay healthy, there is also a real risk of encouraging a more sedentary armchair population. So what can, stakeholders do to mitigate this risk? Andrew, is this something that you want to kind of address?
Yes, thanks, Bing. Yeah, this is a very interesting question. So certainly, we do all agree that access to relevant healthcare information is important. And how can we ensure that everybody is healthier, is more accessible to affordable healthcare through the digital means? I think that's very important. And also I highlighted in the one of the findings of the report is about how can we deal with misinformation as well. So on one hand, I think it's a delicate balance that we make sure that people, they have access to relevant healthcare information so that they can make their own informed decisions. And on the other hand, how can we deal with all these misinformation? And also through the use of technology, I think people, they sometimes may be also skeptical about data privacy as well. And how do we make sure that they are all inclusive? So I think various stakeholders, we need to work together to ensure that the information is reliable, is reputable, is relevant, and we also want to make sure that a greater population, they do have access to all these, so as to change their living habit and to exercise more. Back to Dennis' description is that how do we make sure that we proceed together with their healthcare journey throughout their life cycle? Because different people at different stage, they would certainly have different needs as well. So a teenager's healthcare need is definitely different than to that of an adult, and an adult's healthcare need is definitely different to that of an elderly as well. So how can we stage that and make sure that we provide the relevant healthcare needs to their life cycle? I think that's very important.
Yep, thanks so much, Andrew. This person, basically was asking whether, technology can, will actually encourage a more sedentary armchair population. Of course, with the use of technology now, we are, indeed staying at home a lot more, working from home, not going out too much. But then, with digital health tech, I mean, that's precisely, that's why there's a need for kind of a digital health technology to get people to go out there and actually exercise more and do things and do more activities. So I think in these times that we're living in, it is even more important that we actually continue to encourage people to go out there and stay healthy and take care of our health. And the use of digital technology is very, very key and important. And with that, we've come to the end of the panel discussion session today. So thank you to all our panelists, for that very insightful sharing, very honored sharing, and on this very important topic of health and well-being. So thank you very much for your time today. And over to you, David, to do the closing for this event.
Thank you so much indeed, Ping. What a absolutely brilliant session that was, with some superb questions from the audience. Thank you to everyone that's attended today, and to our fabulous panel. Dennis, C, Andrew, Paulin, absolutely fabulous. Some great presentations, some great content. And of course, Ping, it was expertly moderated by yourself today. So thank you so much indeed. We do have some other dates for your diary, which are just being flashed up on the screen at the moment. I believe we've got a Learn and Invest in the UK residential property post-COVID-19 event. We've got a dialogue with the Work Pass Division of the Ministry of Manpower coming up next week. We've got our AGM on the 20th of May. We've got a Shaping the Hybrid Work Future, some really great engaging events coming from both the Chamber and within the committee structure as well. You will receive a feedback form from today's session. Please do fill that out. It is always very helpful to ensure that we continue to get your feedback so we can improve on all of the content and events going forwards. Finally, we would encourage you to download the Pulse app. This is Prudential's fabulous digital health and wellness app that they launched, I believe it was last year. It's a brilliant app where users can check their symptoms, conduct a digital health assessment, and better understand future diseases and risks, and seek timely health advice as well from anywhere at any time. So do have a look at that. It's on the screen at the moment. You can download that by scanning the QR code. So with that, a final thank you to our panel, a final thank you to Prudential for supporting today's event, a really brilliant event, thoroughly enjoyed today's session, and a thank you to you for attending. I hope you enjoyed it, and we look forward to seeing you at an event soon. Take care, everybody, and have a great day ahead.